Hey, Dr. Fiscella, it looks like she was here, scheduled for her HIV care, but she also mentioned that she's been addicted to heroin for about a year.
Oh.
And she's finally coming to us to see if maybe she can get some Suboxone. I know she'll have to go through maybe an intake, but she does also have a little patch on her left leg, and she was saying that it was red and itchy. Okay?
Got it.
Okay. That's about
Thanks.
it. You're welcome.
Hello, Anna.
Hi.
Hi.
How are you?
I'm doing well. Are you enjoying the change to summer weather?
Not really. It's too hot out there.
Yeah, I'm the same way.
Too muggy.
It's too muggy for me. So Bree was just updating me on. I know you're here for a follow-up on your HIV, and I wanted to talk a little bit about the viral load. She mentioned too that you told her you've been using heroin and you were hoping to get treatment.
Yeah, I'm looking to get on Suboxone.
Ah, okay.
Yeah, some of my friends are on that and they seem to be doing pretty well.
And so we got the HIV, we got the Suboxone question, and is there something else?
Yeah, this patch on my leg, it's been red and itchy and kind of warm, kind of hot. And, you know, I scrub it when I'm in the shower, but it doesn't seem to go away.
Gotcha. Well, where should we start today?
Probably with my leg, it's really kind of bugging me.
Okay. Now, you mentioned the heroin. Have you been snorting or shooting?
Shooting.
And has that been one of the places where
Yeah.
you've been shooting?
Yeah, down here and then in the foot too. Yeah.
So tell me how that started.
It was about 3 days ago when it started. It looked like a little bump, like a little, kind of like a zit with a white head. And so I popped it. And then it just got bigger and bigger and it's just kind of sore and irritating and itchy. And, you know, I'm trying not to itch it, but it's just itchy.
And do you have thoughts about what you think may be going on with your leg?
Well, I mean, I shoot around there, so maybe, you know, I don't always use, you know, I don't always have clean needles. Sometimes I'm reusing needles. And,
That's a common problem to get the cellulitis. That's what it looks like. I'll take a more careful look in a minute.
Okay.
But we can usually take care of that with taking antibiotic pills. And
Okay.
we'll get to that in a minute.
Will those pills make me feel sick?
The antibiotics? No.
Okay.
No, they won't have any effect on your withdrawal. So what should we do with next?
Well, you said you wanted to talk about the HIV, I guess.
Yeah.
Yeah,
I've been concerned that the viral load really has not been undetectable, and often this means that you're missing pills. Has that been true for you?
Yeah. I have friends that have it, and sometimes I sell my pills to get heroin. You know, it's just what I do.
Well, it sounds like that's a pretty good segue into the heroin issue, because it sounds like until we get that addressed, that it's going to be a problem for you in terms of being able to even afford to take your pills the way you need to.
Yeah, is Suboxone expensive?
You know, with your ADAPT, it should be covered.
Okay.
So, if you had to pay for it outright, it would be expensive, but I think it will be covered by your insurance.
Okay.
So tell me what you know about the Suboxone.
Just that it's a pill that you can take that it kind of makes you feel like when you're high, but it doesn't have the same symptoms, I guess, it helps you get off heroin.
Okay, so some of that is true. It actually what it does is it helps prevent, you won't be in withdrawal, so you'll basically feel normal. You should not feel high on the Suboxone. In fact, if you start feeling high, let me know, because that would mean that the dose is not right.
Okay.
it will block the effects of heroin, so you won't get the high once you take the Suboxone. But it will allow you to feel normal and lead a normal life. It's something that you just can't suddenly stop once you start. You have to come off slowly. And it will mean that you'll have to come in at least once a month for a prescription. And for we also do drug testing. And we'd also like to see you enter a drug program as part of that.
Okay.
So
Is there a program here?
No, what we would do is link you with one of the area programs, so that
Okay.
could be Restart, could be Unity, Evelyn Brandon, Strong, whichever is most convenient for you, and then we'd have you sign a release, and we can coordinate care
Okay.
that way with them. So, based on what you've heard, is that something you think you would still want to do
Yeah.
with the Suboxone?
Yeah, I'm ready to try that.
Okay.
Yeah.
So besides those three issues, is there something else that you wanted to talk about today?
No, that's it.
Well, what do you think about us, why don't we move on to the exam, if that's okay?
Okay.
Do you mind if I examine you?
No, we're fine.
Do you mind having me sit up there?
Sure.
Take up your mouth, please. That's good. That looks normal. I'm gonna check your neck.
Okay.
No swollen glands, so that's a good sign. And I'd like to listen to your lungs, make sure you don't have a pneumonia here.
Okay.
Good. And now, if you wouldn't mind showing me that spot on your
Sure.
leg.
It's just right here in my lower leg. It's just hot. And
Oh, yeah. That
Right.
looks like that looks like a definite cellulitis. And
so what does that mean?
What usually happens is when you stick a needle in there, you have germs on the surface of the skin, and they often get in, and then actually, did you say you squeezed it?
Yeah, I popped it.
And when you pop it, it often actually spreads it underneath the skin.
Oh, so that was bad.
Yeah.
Okay.
Yeah, unfortunately, I know heroin can really wreck people's lives.
Yeah. I'm not proud of it.
Yeah,
No.
it sounds like it's been really tough for you.
Yeah. I had one of my cousins was on heroin and actually overdosed.
Oh my goodness,
So that's pretty scary.
I'm sorry.
Yeah.
Well, why don't you have a seat back here and just wash my hands here. Sorry about that. Okay, so we talked about your HIV and adherence and how important that is, and I know we talked before about how that can cause resistance to the medication so that it stops working. So I'd really like you to make an effort to try to take your medication every day, and with the Suboxone, hopefully you won't be out having to buy
Right.
heroin. Do you think that will work for you?
I think I can do that. I think I can take it at the same time. Can I take it at the same time?
Yeah.
Okay.
Yeah,
So then
no, that's
that'll
not a
make it
problem.
easier to remember.
Yeah. And then we'll start the Suboxone induction in a few minutes. And that means what I'll do is send a prescription over to the pharmacy. We'll have you take it and check you, make sure that you're doing better, and then adjust the dose from there.
Okay.
And then on the third problem, I'm gonna prescribe a medication called Bactrim. And I also want you to take a warm washcloth and just hold it over there for about 5-10 minutes, and do that 4 times a day.
Okay.
And that will help help any remaining pus to come out.
Okay.
The Bactrim is twice a day, and I'd like you to take it for 10 days.
Okay.
And then have you come back in a week. So why don't we just go over that, and as you tell me the plan, I'll actually dictate for you and put it right down here in the chart, if that's okay with you.
Alright, so we're gonna start Suboxone today, and I'm gonna really make an effort to take that, along with the HIV meds. I can take them at the same time, so hopefully I remember. And for my leg, I'm gonna take a pill twice a day, and to hold a warm washcloth over that spot on my leg 4 times a day for about 10 minutes.
Perfect.
And then come back in a week to check and see how it's all going.
Great.
Right?
Great.
Do I need follow-up lab work or anything like that? Would work?
We're gonna hold off on that and do that next time.
Okay,
Okay?
that'd be good.
Okay.
That'd be good.
Well, it's good seeing you, and
Thank you.
we'll get the induction started.
Okay. Thank you.